All right. Good evening, all. You're welcome to today's lectures, today's tutorial. So we are going to take a look at AUM, action and uses of medicines. Action and use of medicines, AUM, and we'll start with the roots of drug administration. Roots of drug administration. If you're not careful, you may mistake routes of drug administration and the dosage form. Hello? If you're not careful, you may mistake routes of drug administration and dosage form. Do you really know the difference between the two of them? Dosage form and routes of drug administration. Any idea? Dosage form and routes of drug administration. Any idea? As what?
Those parts of the body that a drug can be administered, like inform which drug is taken into the body through different parts.
A form through drug is taken into the body through different parts. You are missing the two of them. Any idea? No idea. Anyway, you tried, but that's why I asked this question, because especially when at the beginning of, maybe at the early stage of into pharmacology and actions and use of medicine, students tend to, misplace, interchange them, but they're not exactly the same thing. Okay, I will say that route of drug administration is more of, I will say that is human body related. Are you with me? Why dosage form is drug or the medicine related. Now, dosage form has more to do with the medicine itself, the drug itself. While the route of administration has to do with the human body or the person or the individual using the drug. Now, when you say dosage form, it talks about the form in which the drug is presented. Are you with me? Presented and the formulated, presented, and possibly delivered. But if you say delivered, that delivered is somehow we have what is called drug delivery system. It's far beyond, it goes beyond just dosage form. So I cannot fully say delivered, because if you say delivered, it can be misunderstood as drug delivery system. Drug delivery system is far, it goes beyond just presenting the drug in a dosage form. So I can just say that dosage form is the form in which the drug is presented, formulated and presented. It can be solid, it can be liquid. Under solid, we have different solid dosage forms. Under liquid, we have different liquid dosage form. If it's as a liquid dosage form, you can have suspension, you can have emulsion, you can have syrup, you can have lactoses, you can have elixirs, there are many of them. In solid, you can have tablets, you can have capsule, you can have powder, you can have granules. These are different forms in which a particular drug is formulated and presented. Now, but when you say route of drug administration, now you are now talking about the human body. Now, which part of the body through which the right part of the body through which this drug can be administered and achieve and they achieve the purpose for formulation. Am I communicating? One thing is to formulate a wonderful drug into dosage form, and another thing is to get it delivered, is to get it administered through the right route, so that it can exert the effects is meant to what exert. If you don't administer it through the right route, you will not be able to achieve what you want to achieve. So this is the major difference between routes of drug administration and what dosage form. Like now, injection. Let me throw more light on it now. Like injection is injection a route of administration or a dosage form? Someone said that injection is a route of administration.
How do you say dosage?
Have you seen why I asked the question? It can be confusing.
How is it injection?
When you say true, is a route of administration. It's whether you inject it intramuscular.
Good. It's a dosage form. Injection is a what? Dosage form. Now there are different routes of administration you can use to administer injection. It can be subcutaneous. It can be intravenous. It can be intramuscular. It can even be intrathecal. It can also be intraarterial. Have you not seen that? This dosage form now, injection, has different routes through which you can do what? Administer it. Am I communicating?
Yes.
Now, what other dosage? Okay, and that, like now, suspension. Now, hope you know that suspension. You can have suspension as you can have suspension. Of course, generally suspension is a liquid dosage form, right? True or false? Yes, it's a liquid what? Dosage form. Then under this liquid dosage form, under liquid dosage form, we have other liquid dosage form that are not what? That are not what? Suspension, right? Then we have oral suspension. If you now see it's an oral suspension, it's clear that now this suspension can be delivered through what? So what is the difference between oral? When you hear oral dosage form, what comes to your mind?
Any dosage form that can be administered through the mouth.
Any what?
Dosage form that can be administered through the mouth.
Is that all? Then after being administered through the mouth, what happened next?
In order to perform its pharmacological effects in the body.
That's not what I'm looking for. If you hear oral route of administration, what comes to your mind? Listen. Anytime you hear oral route of administration, any other idea? Has any idea come into your mind? Okay, now, please. No idea. Oral routes is not just to enter the mouth. Oral route must enter through the what? Must pass through the mouth, enter the esophagus, down to the where? Stomach. That is oral route of what? Administration. Am I communicating? So it's not just say put it in the mouth, it ends there. Because we have buccal. Buccal acts where? Right in the mouth. We even have sublingual. Are they not in the mouth? So when you hear oral, it's not just to enter the mouth, it has to pass through the mouth, enter the what? We also have the one that acts on the what? Throat, right? Example of a such dosage form is what? You don't know. Have you heard of? Eh? Have you heard of throat paint? Have you heard of gargles? Yes. All right. This is a way of introduction. Now let's go to what we have. Let us now take it a step deeper. Okay. Generally, we have two major routes of drug administration. We have the local route and what? Systemic routes. Local route and systemic route. Now, that is local route. You mean that if you intend the drug you want to administer to have a local effect, then you apply it through local route. If your intention is for it to have a systemic effect, you administer it through systemic route. Do you understand what you mean by local and systemic route? Local, when is it that a drug has a local effect? Do you understand what it means? Any idea? When you say that a drug has a local effect, what comes to your mind? Is what? Say it.
Is the administration of a drug to a site where the desired action is required.
Okay. Any other idea? Okay. Generally, a drug has a local effect if its effect is felt at a particular place. That is, that same spot you administered it. Am I communicating? So now, if you administer a drug at a particular spot and your intention is for it to have effect at that particular spot, that in that case, you say that the drug has a what? Local what? Effect. You know, recently, unlike before, when maybe if somebody want to undergo maybe major operation, are you there? In a theater, they will just give the person an anesthetic injection, and they maybe in those days the person will just sleep off. Am I communicating? The person will sleep off. What it means that this drug has a systemic effect, because the drug will go to the central nervous system, knock off. In fact, it will knock the person off. The person will just sleep off until after the operation. The person will now do what? Wake up. But these days, someone will just be awake, watching the what they are doing to him or her, but the person will not feel any what? Pain. How is it possible? Because of the improvement in what? Local anesthetics that have local what? Effect. Maybe if they want to operate the person in the abdomen now, they will just the person can just be awake, seeing, watching it on the screen, what they are doing to him or her. They will just open the abdomen. The person will not feel any what? Pain. But he will be seeing it. Why? Because the whatever the anesthetic give you has local effect in that area. It will numb the sensory whatever nerve around that area, that the person won't even feel anything. That's a local what? Effect. Am I communicating? Am I communicating? Now, there are also maybe there are some people that maybe they have those that will say that they have vaginal, maybe those that may have vaginal infections, and they use some maybe vaginal cream or pills or nystatin tablets, they will insert. At that point in time, is acting at that particular what spot. It doesn't enter the blood, the whole system and go and even though on treating that, they may still apply the one that has what systemic effect, but that particular one that they inserted there has more of local what effect. Am I communicating? Now, some may be cream. Some may be cream. Maybe those that have some maybe bulbo vaginal candidosis. They just get have you heard of clotrimazole cream? Okay, you still get there. They will apply it at that particular spot. The idea is to do what? For it to have the local effect at that what spot. So there are many of them. You can find out more on drugs that have what local what effect. So it's also a route. Now the other one is the systemic effect, but it's in the systemic effect that we have more roots. We have a lot of roots under systemic what effects. Now under systemic root, sorry. Now under systemic root is subdivided into two. We have enteral and what? Parenteral. Enteral and what? Parenteral. Enteral and what? Parenteral. Enteral and parenteral. Now under enteral, of course, enteral means that is what is entering the what? Is entering where? Through the what? The mouth. Am I communicating? When you say enteral, it means that it's entering the mouth. From the mouth. It is entering the enteric system. That's why have you ever okay? What's the full meaning of GIT?
Gastrointestinal.
Gastro what? Intestinal. Okay. Now the alimentary canal starts from where? Anything from that mouth. Ends that enters. It's a tube that has just two ends. Hope you know. It's just a tube that has two ends. One of the ends is the word the mouth. The other end is what? Anus. So anything that enters there, forget all those twisting of the when you get from the mouth, it get down to the throat, get down to the you have the esophagus will just run down. It will get to the stomach. It will just curve, get down to the intestine, and they will start twisting. Forget all those twisting. At the end, it's just a long tube that opens in the mouth and the what? Anus. So from that mouth to the anus, anything that there is the enteral. Am I communicating? Anus. That's the what? Enteric what? System. Is it clear? So if you hear enteric system, that's why they'll tell you gastroenteritis, meaning that inflammation of what? Let me not take you there. You still do. I think you still do that when you start discussing some diseases like typhoid and what have you. No. Now, enteral and what? Parenteral. Now, under enteral, you have the what? The oral what? Root. The oral what? Roots. Oral roots. Oral roots. Sublingual roots and what? Rectal. Oral, sublingual and what? Rectal. Oral is that it enters the mouth, passes through the esophagus, and get to the stomach, get disintegrated, right? Get disintegrated, dissolve, and what? Absorb. That is what? Oral. Enter the mouth, go down the esophagus, get to the stomach, get what? That is broken down, right? Dissolve. That is dissolution. Then absorb and enter the what? the hepatic portal vein, and from there enter the liver for what? What happened in the liver? What's the name again? First pass what? The effect. Then from there it will not enter the what? Through the system, through the mesenteric what? Vessels. Am I communicating? After absorption, it will enter the what? Hepatic portal vein now. That will take it to the liver for what? First pass. After first pass, it now enter the systemic what? Circulation. Is it clear? Is it clear? So this one now is what? That is what known as the oral what? Root. Now sublingual is below the what? Tongue, right? Good. Sublingual is below the what? Tongue. Then we also have the rectal. Rectal is through the what? Anus, right? Yes, now. How do you assess the rectum? How do you assess the rectum? How do you assess the rectum? Is it assessed? How do you get to the rectum? Is it through the mouth?
No.
That's why I said rectal root through the what? Anus. Example of dosage form that have rectal root menstruation. Good. Rectal suppository. Am I communicating? Good. Yes, I like that. Now, there are some tablets you have that end this through the what? Oral, sublingual, right? Orally we have tablets. We have suspension, right? We have syrup, right? Do you have injection orally? Okay. Good. Now, parentera. When you hear parentera, what comes to your mind? Any other means that is not through the what? Enteric system, through the mouth. Am I communicating? Now we have the here now that's where, in fact, injection is the main thing there. Injection is the what? The main route there, followed by inhalation, transdermal. They don't enter. You see the inhalation now. Good. It can get to the systemic circulation, but not through the what? Enteras, not through the enteral system. It doesn't enter here. Can you assess? Are you aware that you can you assess? Do you think you can assess your lungs through the mouth? Can you? No, so someone say yes now. Oh yeah, tell us how. Tell us how you can assess the mouth.
If you breathe, it's as if there is two holes under your mouth, and the air will enter through that place.
Those asthmatic patients, what are they treating? Is asthma an esophagus problem or stomach issue? So then where do they now use the inhaler? Is it in the mouth or in the nose? So that means you can actually access their lungs through that.
But how? It does not mean there is branches.
No, at the back here, at the back, the nose, the mouth, they link at the back. The nose, the mouth. Have you ever noticed that if you are eating, there's what is called, is it epiglottis or glottis? That narcosis. If you want to eat, if you want to eat, it will close so that what you are eating will not enter the what? Trachea. Am I communicating? But have you noticed that if you are eating and talking, it will not close properly. That's why if you are eating and talking, what you are eating may misdirection. Instead of entering the esophagus, it will enter the what? Trachea. You start it and it's dangerous. What is it called? Okay, you mean that closes epiglottis now. What's that? What's that? What's that? What is epiglottis? Say it.
The epiglottis is a small movable lid just above the larynx that prevents food and
Larynx.
that prevents food and drink from entering your windpipe.
What is windpipe? Trachea. Come closer. You see, again, you see that epiglottis is what?
Is a small movable lid just above the larynx.
A small movable lid that is cover. It's a kind of cover,
just above the larynx.
Above the larynx, continue.
That prevents food and drinks from entering your windpipe.
Thank you.
Yeah.
So epiglottis is what? A small lid above the what? Larynx that prevent what? Food and drink from entering the what? Windpipe. Windpipe is what? Trachea. So if you are eating, keep quiet, don't talk. If you are eating and talking at the same time, you are confusing that lid. He doesn't know whether to close or open. He becomes confused and he may get open. And if it opens, the food you are eating will do what? We leave the way to the guts and enter the what? Windpipe. That's the trachea. And if it enters now, it can be painful.
It's very painful.
It's painful. So the point I'm making there is that there's a link. Are you with me now?
Yes.
There's a link there. That's why asthmatic patient can use their inhaler, put it in your mouth. Once they press it, it will enter the what? Trachea. You know, the mouth is bigger. It can easily enter than the nose. True or false? Most of the things they put through the nose have local effect. Nasal drop, do they have local or systemic effect? They have more of local effect than what? Systemic effect. So, but once you put this one now, it will enter the windpipe and go and take care of the what? The crisis, the asthmatic attack. Now, we have outlined these routes of what? Drug administration, right? Now, as I said before now, local route is the simplest. True or false? Local route is the simplest site of drug administration. Because we said before now that there the desired action is required. And the side effects, systemic side effect is what? Minimal, is limited. In fact, you will not have the systemic side effect. Have you not seen why it is safer to give this local anesthetic doing maybe surgery? Because the patient doesn't need to be knocked off. The person won't feel it. Hey, it's after now. It's after the whole thing now. Yeah? Are you serious? Even after the whole thing, you didn't feel it?
No, I did not feel it, though I was knocked off. Wow.
Okay, you knocked it. Okay. No, I'm talking about. Okay, you were knocked off. Maybe they use systemic one for you. Maybe they use the one that has what? Systemic effect. Now, I say that a drug has systemic effects. Let's assume now. Okay, let's assume now. Let's assume that you are given an injection. It will enter your bloodstream and go through your body. Through the blood, it will go to different parts of your body. It has systemic effect. Am I communicating? It has systemic effect. Maybe if the drug has a side effect of making you to feel drowsy, you start feeling drowsy because it has entered the central nerve, it has affected the central nervous system. You start feeling what? Drowsy. You may even sleep off.
So what is nausea?
Huh? Nausea. Feel if you feel there's that feeling to do what? Vomit. You see that something is nauseating. It's nauseating. It is the feeling. It's not vomiting itself. Hope you know. Hope you know. All right, please. Let's. So have you now seen that local root has minimal what? Systemic side what? Effect. So all the possible systemic side effect that may happen may not happen in the local what? Locally what? Administered what? Drug. Okay, now let's continue. What do you understand by topical route of administration? Apply where? On the skin. Yeah, topical, right? Does topical have local or systemic effects? Local effect, right? But you need to be very careful. Yes, we know it has local effects because what you want it to treat is at the what? On the skin, right? But let me now shock you. Be careful about, like some of you that use bleaching cream that contain hydro what? And some of these, be careful because they even in as much as they have local effect, they enter through the skin, through the blood. Yes. There have been cases like that where most of the because of what someone apply on the skin, it has internal effect. So be careful, eh? Is that what? It's not bad. So the point I'm making that is that these things happen. But as for where the effect you want, maybe somebody has rashes or somebody has some skin infections. Am I communicating? Now the person may be fungal infection on the skin, scabies, eczema. Is scabies a fungal infection? It's not too.
How do scabies is it the rashes that used to pick?
No. Scabies is more serious than that.
So that one is called what?
Which one is that?
You will have rashes, especially here, and it will be pain, your skin will be pain. That
Rashes.
is happened to you. Yes. Just tiny.
You know, most of these things present itself. They look similar. It's when you see it. It's when I see it exactly. I know exactly what it is. Am I communicating?
Yes.
Because you may not even be able to describe it well. A lot of things may cause it, but having seen how it's presented, I cannot say okay, this is what it is, and the history of how it happened. Am I communicating? For now, I may not be able to say anything based on what you are describing now. So topical, but generally topical route of administration is a local route generally. Am I communicating? Now, are you also aware that there are some drug you administer you in the mouth that have local effects? Are you aware? Example. What? Huh? Vitamin C. Local effects in the mouth.
Yes, when you have something like gold. Even drugs like
Have you heard of nystatin oral suspension? Those that have oral fungal infections. There's a fungal infection that happen in the mouth. Yes, you can administer. It's common with children. If you look at their mouth, inside their mouth, on the top of the roof of the, you see that it's white, and they'll be crying. They'll tell you to get nystatin oral suspension. That nystatin oral suspension you administer in the mouth there doesn't have systemic effect. It's local effect in the mouth there. It will clear it. Nystatin. Okay, mouth ulcers. Yes. There's also a drug you can use. This common drug, Bonjela. Yeah. Yes. Yeah. It's a brand name. Please, I want to advise you on something. At this level, how many of you have MDEX? How many of you have MDEX? I told some of your classmates that I have link with the company. You can get it as students. I don't know if you are aware. I'm a kind of I do advert for them anyway. So there's this. They gave me this because that if I can get student that student can buy it at a very cheap, reduced cost, very cheaper than what they sell it in the market. How much I tell you last, Choma? It's if you go. Child.
You say that it's 10,000 company price. Then they now reduce it to 8 something.
Okay, now I said that some suspension, like nystatin suspension, that you put in the mouth has what? Oral what? Good. Then we also have some drugs are administered as what? Troch, something like clotrimazole. Yeah, as a troch. Something like clotrimazole for oral candidiasis. Oral what? Candidiasis. It has local effects. Candidiasis is caused by what? It's caused by what? Yeast.
No yeast infection.
What's the name? What is the actual name? Candida what? Albicans. Okay, yeah? Okay. Now, there's also cream you apply where? Orally. For what? Herpes what? Labialis. In the mouth. Herpes what? Labialis. Something like acyclovir. Acyclovir is an antivirus. I think you do it in your final year. Antiviral agent. Acyclovir is also there. There are many of them, even lignocaine hydrochloride, lignocaine hydrochloride as topical what? Anesthesia is also there. Which one? My I sure you're not calling brand name. Is it Myconazole? What about it? Skin infection. The cream. That is if you know it is an antifungal now. So for fungal infections too, yes. But it's now topical. Hope you know. But it also have a local what? We are done with topical agents that have local effect. We are talking about oral one now. Are you with us? Yes. Oral. So whenever you hear oral, don't say that because it is oral, because it is oral, it doesn't have local effect. No. Orally, you can say have what? But in the oral cavity anyway, please, oral cavity, it can say have what? Local effect and what? Systemic effect. Am I communicating? Yes. Now, do you think that there are drugs that can be used even right inside the GIT and still have local effects? Yes. Example. There are some tablets that they are not absorbed. Yes. Some tablets are not absorbed. Yes. Some like what? Neomycin. What they use it for? You good. That's the term. To sterilize the where? The gut. For what? To prepare it for what? Surgery. They used to sterilize the gut in preparation for what? Surgery. Can't you see that it has a local effect, right? Yes. Good. Because is neomycin an antibiotic? Is it an antibiotic?
No.
Huh?
Yes, it is.
Someone said no. It's used to clear it of any bacteria to go there, so that it can prepare it for what. So because any surgery you are going to do, whatever you are going to do there, it should be in a sterile because to avoid infection, disseminated bacterial what? Infection. That one is the worst too. When it enter the system and starts, through the blood, circulate the whole system. That one is the worst. Is the worst what? Worst part of that type of what? Bacterial what? Infection. Is it clear? Yeah. It's antibiotic. It is. It's antibiotic. But we are saying that as a tablet in the GIT, it's used to do what? To sterilize the gut prior to surgery. That it has local effect in that situation because it is not absorbed. Because if it is absorbed, it will enter the systemic circulation. Hope you know. It will enter. It will pass through the normal process, go to the through the hepatic portal vein into the what? To the liver, first pass. From there, it will now enter the systemic circulation through the mesenteric what? Vessels. Am I communicating? But in this case now, it is not absorbed. So it will remain there, do its work there. What of rectum and anal cavity? Do you think there are ones there? Rectum and the anal canal, not cavity. Yes. Rectum. I think we mentioned rectum here. Yes. Local effects. Locally, rectum. Which one? Locally, which one?
Which one?
Which as which dosage form can we administer through rectal routes for local effect, not systemic effect? Example. The one that have purely local effect, rectum. We have enema. Yes. Enema has purely what? Local what? Effect in the rectum. What is enema used for? We have the one that is called evacuant enema and retention enema. Evacuant enema is to evacuate the content of the what? Bowel. Are we there? Yes. To evacuate the content of the what? Bowel. But retention is for what? To treat what? To treat what? Colitis. Colitis. From rectum, what do you assess? What is next? After the anus, rectum, go up a bit. What else do you see?
Which one?
No, I'm not talking about parts of the GIT now. From the anus, go up. You have the what? Rectum. What else do you see? Is rectum part of the large intestine?
Yes.
And then after rectum now, what else do you see as you go up? Is what? Yay. From anus, go up. We know what part of large intestine is that. You do see after the rectum. We have descending colon now. We have descending colon, transverse colon, and what? Child. Okay, in all, colon is what you see.
Afterwards.
As you go up now from anus, rectum, colon, is not true. Wait, have you people done GIT before?
No.
She said we should read us.
Who?
Our AUN.
That we should go and read GIT.
Yes, that when she's going to teach us.
Have you read GIT? Have you read GIT? Child. Did you read GIT?
She says that GIT is 9, 1, 2 from the mouth to the anus.
I've said that one here now.
That's what she said. There's nothing.
Hey, Lord, let me even not tell you something though. Listen, at least you are level, low. At least you are level. Don't expect anybody. Don't expect anybody to just come to class and pick everything from the beginning and start teaching like that too. We are told go and read up this thing. But I told you before now that this what you see in your second year first semester. I told you no gay. Couldn't be no gay go back. It could be no gay. So you shouldn't be surprised by now.
They're not surprised.
So, but who has opened GI, the structure of the GIT?
Me.
I don't know what how can you go to GIT structure and you didn't come across colon?
Hey.
This is becoming serious. So. How can you read two parts without structure in GIT? Does it make sense? Is the picture not? Is the diagram that you see that will guide you on? Don't cram it. Just look at the diagram, study it, see how it is.
Yes.
As you go up from the anus, as you go up, after the anus, you enter the rectum. From rectum, you go up colon. Not even descending the direct itself. You see sigmoid colon first. Sigmoid. Hey, I'm even confusing them more. Try. Check here. Go online now. Get me the diagram. Get me diagram of GIT. Fast. Just browse. Just diagram of the gastrointestinal tract. The diagram. From there let me at least. Oh. is you understand better with the visuals than just talking. Fast. So have you opened it? See the one Nancy. Come closer so you can see the one Nancy.
Okay,
So,
descending colon.
anus. You have the rectum. And you are there. No, I'll come there and show you. No, thank you. Go to us and stay. Look at it. You know, I first mentioned descending, but I said no. That after the rectum, see the anus now. After the anus now, rectum. After the rectum, sigmoid colon. After the sigmoid colon, after the descending colon, ascending transverse colon. After transverse colon, after ascending colon, sorry, you have the word ileum. Ileum, yes. It's ileum that is close to the what?
Intestine.
The large intestine. After ileum, you have the word jejunum. After the jejunum, you have the word duodenum. After duodenum, you now enter the word stomach.
So that duodenum or stomach.
I'm coming. After the stomach now, you now enter the word esophagus. From esophagus ended in what? Larynx. Larynx now, you now enter the mouth. Is it clear? Is it clear now? Now, see it here. Stomach, continue with the word esophagus. And that larynx is somehow, how do I put it now? It's larynx. That's why you have laryngeal this thing. What covers the mouth of the? What covers the mouth of the larynx is what? The mouth of the larynx. Epiglottis is good. It covers it so that food will not go to the what? Trachea when you are eating. That's why you don't eat. You don't talk while you eat. So jejunum, duodenum, jejunum, and ileum make up the word small intestine.
So where is the Jew?
Is down.
Duodenum, jejunum, and ileum make up the word small intestine. Am I communicating?
Yes.
Why the colon and the rectum make up the word large intestine. The colon is divided into three. We have the word ascending colon, transverse colon, descending colon, and sigmoid colon. The appendix is attached where? At where? At the end of the word. It attached at a secum, which is at the end of the word ascending word colon. Have you seen it now? Have you seen it?
But it's inside the stomach.
Appendix is not inside the stomach.
All of them are. Gallbladder is just like that thing that used to burst in. How?
Yes.
Yes. That contains bile. We are not in anatomy class. So let's go back to pharmacology.
Well, this thing they say that someone have appendicitis. How does it develop?
See it now. Appendicitis is the inflammation of this appendix. Now, when this appendix inflamed, become bigger than the usual size. That's when they say that the person has appendicitis. When they now want to remove it, they undergo a surgery called appendicectomy to remove the appendix. Appendix is the part of the is the end is just an I could call it an outgrowth or whatever towards from the part of what? One end of the what? Ascending colon. Now, this is the appendix. Appendicitis is inflammation, appendicitis of the appendix. Why the surgery itself is what? Appendicectomy, to remove the what? Appendix, the inflamed appendix. Huh? Yeah. Yeah. All right. So this is what happens here. Now this evacuant enema is just to do what? To evacuate the what? The bowel. Example, we have soap water enema. Am I communicating? We have soap water what? Enema. It acts as a lubricant. And the water stimulates the what? The rectum. Then retention enema is for ulcerative colitis. What is colitis? Browse it. Colitis. You see, is this colitis that led me to colon?
Colitis.
Browse colitis.
Inflammation.
Browse it. I want to do it yourself. Una use your phone. Let's do it together. Oh yeah, browse it.
It's like a disease or something.
Yeah. But is colitis that led me to start talking about colon. But colitis, colitis, colitis.
TIS.
Oh wow. So let me
Fast.
An inflammatory reaction in the colon.
Have you seen it now? Colitis.
after autoimmune infection.
Colon, colitis. Are you with me?
Yes.
So ulcerative what? Colitis. This is how to study. If you see some things, if you are reading your materials, you notice something. You can use red pen or any blue pen or black pen. Write it down in your notes. You have learned that one. There's no day you sit down and know everything like that. No. It's because of this colitis that led me to start talking about what? Colon. And this is the reason why you are told to go and study what? The GIT, anatomy and physiology. You know, it's not the work of your pharmacology lecturer to come and start teaching you anatomy and physiology. That's why she gave you as an assignment to go and look into it. So what you would have done is to read it, make note from it, see the diagram, capture it, keep it in your phone, go through it, so that when she's teaching, you understand what she's saying. Like now, if you don't know anything about the GIT, will you even know what colitis is all about? So it has to do with what? Colon, inflammatory, whatever in the what? Colon. But it is autoimmune. Is it autoimmune? Now the point there is this: that retention enema. Example of drug used as retention enema is methylprednisolone. Methylprednisolone is used in ulcerative what? Colitis. If you are smart, sharp, you put down the meaning of ulcerative colitis. Read that for us. Let's see.
The chronic inflammatory bowel abnormal reaction.
Good. The major thing there is that there is inflammation of the what? Colon. True of us. That's the key word there. Other things are just how it is, what causes it, whether it is autoimmune or whether it is. Now, have you not seen that? Have you not seen that in rectum and anal canal you can still use what? You can still use what? It has what? Is under what? Local roots. You have it under local what? Roots. Now, you can also have even suppository. Yes. Suppository can also be used. Next suppository with local root. Not all suppository has local root, is for local effect. Note that one. Oh. There are some that have systemic effect. Example of the one that has local effect is your what? Bisacodyl, Dulcolax. The brand name is Dulcolax. Dulcolax is brand name. Dulcolax. 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 It's for constipation. In case for pylori is anosol. This Dulcolax, the brand name is Dulcolax, but generic name is Bisacodyl. Bisacodil, Bisacodyl, Bisacodil is for what? Constipation. Are you there?
Generic name of Nicholas.
Ducolax, but the brand name is Ducolax. The brand name is Ducolax. The generic name is Bisacodil. It's for what? Constipation. Maybe onya that you won't say. The person take it. It will do what? Yeah.
So what's the cause of pie?
Indigestion. Okay, pie. What is constipation?
Bile has not just one or two causes. It has number one is this. Number one is this. If you somebody that has constipation frequently and you keep forcing yourself when you already have constipation, instead of you to go and to treat yourself, you keep forcing yourself to poop. It can lead to what? Bile. Have you heard of anal sphincter? Yeah. You know, if you study the anal region well, is that what? Good. This girl is good. She's good. I like that. If they get weak, if they become weak, it can lead to what? Pile. Then blood vessels, actually, most of pile, we have internal pile and external pile anyway. The one that you can see it bulge out. You see the blood vessels around that place. They bulge out. The one that internal, you will not see it. Now, yes. Yeah. Your ear. In the ear. You fit in the ear. That's the question. You're talking about anal region. You see, anal is where? Anal opening now. That's where you see it. Pile is not a good thing. No? Hello, most of you that don't eat food that has fibers. You keep eating refined flour. You eat biscuits. You eat, name them, noodles, junks. People that eat junks, sugary things too much, eat junks, don't take enough water, they are at risk of developing what? Pile. There are people that will eat, and once you start seeing yourself, you go to the toilet, you stay there for like, watch out. Most of these girls that eat those nonsense, they go to the toilet, they will stay for like 1 hour before they come out.
That eats junk.
You don't know. Are there not people like that in your hostel? How I know. I am not there, but I've seen what you eat. Man, how they big. Some even when they start crying. But if you eat fruits, vegetables, mainly food that have fiber like fruits. You see orange, that's why if I take orange today, I eat that.
Inside.
I don't just take the juice, I eat it. It's very good for you. Yes. It's very good. I don't play with it.
It's too much hunger.
I don't play. No, it's not about hunger. I eat it for on purpose. So I can have enough fiber, roughages in my system. So these roughages, they aid in proper digestion and they prevent this constipation and that may lead to what? This power.
So all these our intestines
How?
Yes. When is your body communicating?
No, your body, of course, now your body has your body, the human body is well coordinated through nerve. What are the two major coordination listings? Through have a nervous and what? Hormonal. Nervous system, hormonal system. These are the coordinating system in the body. They coordinate, communicate with the other part of the body through hormones and what? Nervous system. Now let's continue. So Bisacodil is for what? Constipation. To evacuate the bowels of maybe nonsense in the cover, and you couldn't take them away out from your top. If you take Bisacodil, you can take it as tablet too, and inside as suppository. Yes, it comes as what? Tablet. That tablet now has what? Does it have systemic effect or local effect? It's local. Good. So this suppository is local. Have you seen it now? I do not appreciate this route of drug administration. A particular drug may be administered into 1 or 2, 3 different routes. Paracetamol can be administered oral routes. Injection, parenteral.
So can you put oral paracetamol in drink?
Yes.
Through what? PG? But what do you want to achieve in putting paracetamol? That you want to. It's mostly maybe most of this antibiotic through injection PG bag, IV PG bag. Have you heard of IV PG bag before? Child, don't worry. See here it. You are in it now. Those ones, all those ones you put through drip. Any maybe flagell or any drug you put through, any injection you put through, instead of administering directly, you put it through drip. So you can enter the system. Is what? PG bag. That is what you would call IV what? PG bag. PIGGY. PG bag. Now let's go. Now, what do you think? Do you think you can have eye, ear, and nose?
Yes.
How? Which as local effects? Example.
All this cream
For local effect, example. Eye drops now. Ointments, sprays, nasal spray. Bam. I think I mentioned it here.
Yes.
It has local effects. Eye drops in the eye. If there's that effect in the eye. Ointments, whether eye ointments, eye drop, they all have local effect in the eye. Most of them are for infection and for allergy. For infection and allergic condition. Like you have your gentamicin ear and eye drop. You have your chloramphenicol ear drop. Eye drop, even ointment. It also exists as ointment through eye ointment, chloramphenicol. These ones are antibiotic. We have the one for maybe the one for that this drug they call this popular eye drop they call Spasalage. We have another brand they call Ocolage. We also have the one they call Antalage. All of them contain the same thing. It contains antrazolene and other combination. It's for what? Allergic reaction in the what? Eyes. Not all eye drops are for infection. Some are just for allergic reaction. To take care of allergic reaction. Some are for pain too. We have diclofenac too. Are you aware? Yeah. Are you aware that we have diclofenac eye drop? Are you aware? For pain, are you aware? Ointments. We have eye ointment now. Yeah, we have eye ointment. Yes, that one is not drug. It's not a liquid form. Is ointment a liquid form? Ointment is a semi-solid form, liquid form. A semi-solid what? Dosage form. True or false? Then we also have. Do you think there's one we can put in what via the word bronchi to have local effect? Example. Inhalation, right? Example of such inhalation is what? Salbutamol. Good, I like that. For bronchial asthma and chronic obstructive pulmonary disease. I think you are doing asthma now. I think you should be familiar with these terms now, by now. Then we have skin now. Skin. I think I have mentioned that we have your cream, lotion, blah blah blah, powders. What have you? For cutaneous candidiasis. For cutaneous what? Candidiasis. We have your what? Clotrimazole. For cutaneous what? Candidiasis. You say what? Candidiasis now.
It's an infection.
It's an infection. Mucus. Now, hello. In as much as we say that injections have systemic effect. There are some injections also that have what? Local effects. Intra-arterial routes, but it's not common anyway. It's not common. It's mainly used for what? Diagnostic purposes. Intra-arterial. Inside where? Artery. Intra-arterial. Artery roots. It's rarely used, but it's mainly used for diagnostic purposes. Maybe something like if you want to maybe coronary artery now, coronary angiography. Where is coronary artery located? Hey, coronary artery. I saw people drawing. Where is it located? Go back to anatomy. Where is the coronary artery located? You have not even written an exam yet. You have forgotten what you I saw people drawing here since. Is what? The one that I came here, I saw heart. Who drew that heart on the board? Then after drawing, okay, don't you know that coronary heart is defined in heart? Is it the heart now? Now, Junior, when I say long, I say coronary. It's in the heart. So, coronary angiography, they use it to study what? The coronary what? Arteries. So, I'm trying to point out that intra-arterial routes is used for one for coronary what? Angiography. At the same time, for what? To administer some anti-cancer drugs. Anti-cancer drugs. Some anti-cancer what? Drugs. Very, very important. Who is this? Hey. Character day in this life. All right. So another local route is administration of drug into deep tissues. Maybe deep inside the tissue is for local effect. Because it has no business to do with blood, going to the blood and start moving around. Deep inside tissue. It's for local. Please, administration of drug deep into the tissue by injection. Example of such drug is what? Triamcinolone.
So we use the tissue physically. There's injection they used to.
Didn't you do anatomy? Excuse me, didn't you do anatomy? So what type of question is that one? When you did anatomy, what were you told about tissue? Is tissue? Is tissue? Anyway, sorry for attacking you. I said you can ask any stupid question. It's allowed. I'm sorry. My bad. I'm sorry. This is where you can ask stupid question. Ask it. I'll answer. Anatomy. Okay. No, she's asking me whether she can see tissue with her eyes. No, that's why I said I attacked her, but I forgot that I said that you can ask any stupid question here. No. Okay. Let me take it out. Let me take it out. That's why she's here. That's why we are here. Such question. Let me take it back to your anatomy. In anatomy now, maybe you have gross anatomy and microscopic anatomy, right? Yes. Gross anatomy is one you can see with your eyes, right? Organs at organ level, right? Yes. But from anything from tissue level is histology, cell level is cytology. Anything from tissue level down you cannot see with your eyes. Use microscope. Is it clear? Yeah. So as you are injecting it, even if you're not seeing it, it's entering the tissue. Are you there? But you will not see the cell with your eye. Tissue. From the what? Vein. Hey, you see, most of the veins are, except deep veins anyway, most of the veins are superficial. Come. There are people that are gifted that you can see their vein.
Yes, like me.
Can you see your smartphone? Yeah, yes.
So which one is muscle?
See muscle here now.
So through skin, they'll just choke it anyway.
Yeah. You target, you select what you want to inject now. You look for the vein now. But anyway, that is not hope. Hello, as pharmacy technician, that hello, is not your training. No. Even pharmacist is not our training. Pharmacist that give you injection is doing it on his own. If he backfires, you go and answer question. It's not their training. Like me now, I don't give it. Before people will beg me, I don't give injection because to me, I don't want issues. Of course now. See, hello, why is you can give someone injection? He goes out. You may not actually be the cause of that problem. The person may go out and say one thing and come back. Then you'll be asked, did you give injection at all? Trouble has done what? Started.
Is it only drugs that pharmacists put?
Huh?
Is it only drugs?
They dispense drug.
Is it only drug they compound?
What again?
Yes, now.
And
One time in class, we were talking
Is it
about
about-
this.
Medical devices now.
Yes.
Yeah, it's our work too. Sutures, yes. You don't know medical devices, anything that drugs, medical devices. Name them. Your syringes. Name them. All those things you use in hospital. Yeah. That's why you hear drugs and pharmaceuticals.
This is a very big
They say that if you want to inject
We are not nurses. We are pharmacists. Please, let's continue. Let's continue. Now, so I was talking about administration of drug into what? The deep tissues by injection. Example of such drug is triamcinolone. Triamcinolone, where it is directly injected into the joint space. Joint space in rheumatoid arthritis. What is that route of administration whereby you inject into the joint space? What is it called? Synovial what? What is the cavity in this joint? Synovial what? Cavity. Synovial cavity. So if you inject deep into this place, what is this root called? Intra what? Centarius. Synovial fluid is fluid found inside the synovial joint. You see this your knee joint now. You see this joint is point of meeting of two bones, right? Yes. But the two bones, they don't touch each other. Do they touch each other? The ends of the bones are covered by cartilage. Now inside there's a space between. There's a space. Is there? Okay. There's a space. That space is called the synovial cavity. The fluid there is synovial fluid, and it's there for lubrication. Because if the synovial fluid, in most of patients that have arthritis, that have rheumatoid arthritis, their synovial fluid is dried up, and the cartilage will start crush each other. There's no lubrication again. The cartilage will be, there will be friction between the two cartilage of the two bones that end there. And as the two cartilage are rubbing each other, the two ends are rubbing each other, the cartilage will be wearing out. It will wear out. In fact, the worst case is when the cartilage has even wear out. The two bones will just it can be painful. No, I have not, but I'm just feeling. I just feeling how the pain.
That makes that tissue to dry up.
Some can be autoimmune disease. So maybe when when the immune system of the body will start attacking. Yes. Especially rheumatoid arthritis. Hey, you would have taken me around topics we are not discussing today, but it's okay. It's okay. It's okay. I think in our next class we'll start from where? Systemic roots. Remember, this class we are not rushing. Read your normal thing. You do your thing. I'm taking it step by step. What I'm preparing you for is not just to come and. It's not just for you to go and write your exam, because I noticed that some people will just open their material, cram everything, and go and pour. But when you bring them out to discuss, engage them in discussion that has to do with that topic, they will have nothing to say, because to them they have gotten A. That is all they need. But when that thing they need to practice, you see that the person is lacking, and I don't want it to happen to you people. So I think we'll stop here. We'll start. We are supposed to do dispensing today, but another what this pharmacology took me on away. I started talking, and tomorrow in the next class it will not be like that. I will send the timetable to the WhatsApp group. For next class we'll be strict on that. 1 hour per course. Once we use 1 hour, we enter the next course. So please, I want you to study. Don't waste your time. Study. Don't just study to pass exam. Yes, you are here to build your GP. You are here to pass, but don't just pass. Don't just study just to pass exam. As you are studying, try to understand what you are reading. Try to understand what you are reading, and try to make it practical, relate it to real life scenario. You say what? Any question? Example of what? Pastry. Example of pastry, we have there is a combination. There's a combination of clotrimazole, metronidazole, and lactobacillus. Is it lactobacillus? Yes, 4 of us. Yeah. We also have clotrimazole alone, pastry alone on its own. Are you there? So it depends on what you have to. There's one that has only clotrimazole alone. There's one also we also have most of the pastry, most of them are center around this clotrimazole for vulvovaginal candidiasis. Most of them center around it. But this brand, I've forgotten the name. This one I call now, I've forgotten the brand name. When it came out, we are among those that marketed it when I was working in community pharmacy. I've forgotten the name. It has clotrimazole, metronidazole, and I think it has lactobacillus spore or something. Yes, in market. What is the name again? Very popular by Sea Green Pharmaceuticals.
So that means you carry a drug and walking around marketing it.
No. Then I wasn't a rep. Then as now I was working in community pharmacy where I was now. When I was among those people that recommended it for patients. Well, that time I hadn't entered field. I was just working in community pharmacy. Me now, no, I don't have.
So but you can open a pharmacy.
Of course, I can.
So what are you waiting? Yeah.
All right, thank you very much for today. See you next time.